for that. I love the way you've mentioned the digital divide. So imagine, for instance, if somebody is sitting with a Mulika Mwizi phone and can't access WhatsApp, presumably you have a channel on SMS to deal with them, correct? So you do provide for those who are not as connected as you'd like them to be. Yeah. Monica, please give us your last remarks as well.
Okay, so for the healthcare space, the way forward is on two aspects. It's creating convenience and being patient-centered. Hospitals that will not be doing this in the future, I don't think will succeed. So in terms of convenience, people want things brought closer to them. They want ease of access. So telemedicine is here to stay. Home delivery of services. Yeah, why does a patient who only requires palliative care have to stay in the hospital? Why can't we give the care from home? Doctors even coming to see you from the comfort of home. These things are happening. So convenience is here to stay, and hospitals that can innovate around convenience. And the Gen Zs that you're talking about, it's about convenience. They're not going to stay for 5 hours like the way we used to. They want, microwave results. They want you to move very fast. So I think innovating around convenience, that's the space, the way to go in the healthcare industry. The other thing is being patient-centered. I think we've really moved from the era of clearing and forwarding. You're just seeing patients, you're not even listening and you're writing a prescription. People have really evolved from that. Nowadays, the doctor you want to see is a doctor who pays attention to you, who listens to you, who engages you. And what does this do to you? It builds trust, isn't it? Yeah. And when you get a prescription from that kind of a doctor, then you're willing to adhere to treatment. You're willing to, to comply to that treatment. Yeah. So at the end of the day, for me, how I see patient experience, it really, it's a very big conversation, because such things really contribute to the overall health within our country. Because if you think of the pain of going to a hospital and you're thinking I have to queue for 5 hours, I'll be tossed from here, there. By the time you're going to the hospital, it's when you're critical, isn't it? Yeah, and we want people to, go for wellness and you check how you're doing. But the thought of going for your wellness is just excruciating. You have to put a whole day aside. So we really have to think into all this. And when we do that, then we prevent people from having even this catastrophic expenditure that we hear about. Yeah, because by the time you're going there, you're in stage 4, all the money is going. Yeah, but you didn't want to go when it was just a simple lump, because the thought of that whole process. So we really need to look at patient experience as a way of alleviating patient suffering. Thank you so much.
Thank you. And lastly, Joseph, please, your remarks.